in here while we get going. Thank you for being on. We've got so many of you on here. It is a pleasure to have you with us. Thanks you for spending the time. And we are going to show you a good show, I hope. So let's go ahead and let me get everything set up. I have got to start this. I have got to hit that. Tell me in the chat that you can hear me. Tell me that you can see me. Should be able to hear me. You should be able to see. Let me make sure that everybody can see each other's. You should be able to see each other's chat, so that's good. You can hear me, you can see me. That is good. And we have got a special guest on, which we are going to get later on. Tell me what kind of dentist you are. Tell me where you're from and who you are, and just introduce yourself so everybody gets a sense. We have hundreds and hundreds of you on. We've got nearly 1,000 registrations, so there's a lot of interest in this topic, as many of you know. So if you're a dentist, but this is really open to anybody, but certainly if you're a dentist, this is going to be specially for you. So welcome to everybody. Welcome to, I'm just going to call out some names, but they're coming way too fast for that. Welcome to, I think, Duke, general dentist from Idaho and California, Jacqueline, an orthodontist, Audrey, a general dentist, Cody, a DDS from Billings, Montana, and you can see a lot of the names that are coming through on the chat. You all should be able to see the chat there too, so that would be nice. Sean from Michigan, I'm just catching names as they're coming by for that. Felicia, a general dentist, Lana, an international dentist, an orthodontist. We've got periodontists on, we've got oral surgeons, we have got just about, there's an endodontist, we've got multiple platforms that we're on. So welcome to all of you. I'm not going to get to all of you. I apologize for that, but go ahead and just keep talking in the chat, and you guys can all see each other for this. Let me just go ahead and get rid of this for right now. That'll work. I'm just trying to get all my buttons together here. All right, let's get going here. We have got a lot to cover in a short period of time. Feel free to ask questions at any time, if you will, and that will work too. And let me see what else. We're going to show some videos, so anything on your side that is going to slow down the video, make sure you put it on hold. We've got dental hygienists here, so really welcome to all of you. We're going to get going here. Let me put up my slides. So I'm going to ask you now, can you see my slides? And I'm going to go to full screen on the slides. And now you should be able to see my slides as well. So tell me in the chat that you can see that. And then I will leave you alone for the time being, if that's okay. Tell me that you can see my slides. You should be able to see me. Should be able to hear me. You should be able to see my slides. We are good to go. So welcome, everybody. And it is great to have all of you here. All right, let's talk about a special filler for gums. You don't have to have any experience with filler for this. We're going to show you just the gum filler. We'll show you a little bit of Botox and fillers maybe at the end, or at least some Botox so you can see it. But this is going to be life-changing as it has been for many, many dentists, and more than many, many dentists, for thousands of patients around there. My name, quick introductions. My name is Dr. Louis Malzmacher. I am a general dentist and from Cleveland, Ohio, and got multiple practices and also have multiple med spas. So it is great to have you all here. There's my email. I'm also president of the American Academy of Facial Aesthetics. There's my email. There's the AAFE's email. There are a few websites we're going to point you to, so you might want to take a picture of this slide. There is a recent photo from an AAFE training on injectables, Botox, and fillers, and we'll tell you a little bit more about what we do. Please follow the AAFE at Facial Aesthetics on Instagram, Facebook, YouTube, and TikTok. So make sure you follow us on all the social media channels. Again, just by way of quick introduction, the AAFE is a live patient training, the most trusted name for injectable training for all healthcare providers, certainly for dentists, because dentists have to stay within their scope of practice. You have to know how to document. That is exactly what the AAFE teaches and specializes in. Exactly what dentists. We consult with all the different medical, dental, nursing, licensing boards. I was on the phone with the dental board yesterday. New injectables and technique development. We have full-time faculty that are there to help attendees. We have the best faculty in the world. You're seeing some of our 80-plus faculty and they are amazing. Not most, but I would say 60 to 70% of them dentists and endodontists, orthodontists, oral surgeons, periodontists. We've got everybody, dental hygienists, and we have got physicians, nurses, nurse practitioners, PAs. We have got everybody as faculty, and they are a great group. And we've got the highest ratio of instructors to attendees. Where do we give our courses? All over the United States. These are injectable courses. These are gum builder courses. We're going to point you to all of that. And these are some of the courses that we give. These are all live patient training, all CME. These are ADA CERP, AGD PACE. We give a lot of our courses in conjunction with the American Dental Association. We've given them at the AGD before too, and various other dental association meetings and also medical meetings around the country here. So whether it's level 1 foundational Botox and fillers, level 2 advanced, level 3 master, then a whole bunch of other courses that we could talk about. But we also give, what's our topic today is gum builder live patient courses. So we'll give you the different options of, I know a lot of you have already expressed interest even before we started about, how can I get trained in gum builder? But these are the live patient courses that are coming up that are not already sold out. So if you want them, absolutely go ahead and get them. We also give them, like you can take 2 days worth of courses, level 1 Botox, level 1 fillers, level 1 TMJ trigger point therapy, and gum builder, all in 2 days. And those are the ones that are starred right there. So if you want to get trained, here is a special offer. I'll talk more about this later because I really want to get the program going. But there are only 20 of these packages that are available. So if you want them, go ahead and get them. QR code can take you there, aafedentist.com. If you want to open up that page now, then you can look at the various options. If you want to go all in on clinical and aesthetic practice, and it's about time you got trained for Botox and fillers, and we certainly give many courses on that, then they have got a special offer. This is better than any Black Friday. This is only for the webinar. It's only till midnight tonight of $39.97 for 3 live patient certification courses, plus all of those bonuses. There are 11 bonuses there that are worth over $13,000 when you total up the whole thing. And that includes that package, the Gum Builder online certification course. And this is only till midnight tonight. It also includes injectables for the course. It also includes so many other things, business on demand training, all the different things. You can take a look on the website. I'll come back and answer. They usually give me a lot of training questions, so I will come back and answer many training questions a little bit later on. If you just want live gum builder certification course, then you can save $200 off. Actually, it looks like $700 off, but I think they have a special running now and an additional $200 off by going to aafedentist.com. Click on that and use that code at checkout, GUM200. Or if you just want the online certification, you've got that option there as well. So go there, go to aafedentist.com, and you'll find everything there. The full package, though, is quite the bargain. I mean, there's nothing that even comes close, nothing Black Friday that they're going to have. So if you're interested, grab it now. There are only 20 of these packages available. You will not see a lower price anywhere on the AAFE website, nowhere else, but this is only till midnight tonight. So if you've been thinking about it, here's the kick in the pants to do that, and it includes the Black Triangle on-demand certification as the #1 bonus, and then thousands of dollars of bonuses after that. So that's the start you off to those who want to get in early on this, because I will tell you those 20 packages will go maybe by the end of this webinar, but certainly by midnight tonight. By the way, you can lock this in. You can use this next year, the year after. It doesn't make a difference. You don't worry about the location. You'll get the location you want, but this is not, you don't have to take this within a certain set time. You've got at least a year to go ahead and take these courses, but you will not see this cheaper anywhere else. So this is really a bargain. And if you stay till the end, we're going to talk about the #1 training that injectors use to make $50,000 to $100,000 a month, in addition to whatever you're doing in your dental practice, while your family and existing patients are already paying someone else for Botox. The best investment that will pay you back with your first 5 to 6 patients. I just want to say one thing here on, because I'm going to get to 2 very disturbing slides that are coming up next, actually. I just want to say this coming on. how much did you pay for dental school, right? Think about that. 200, 300, $400,000 or possibly more. You may be in practice for 5 years, 10 years, 2 years, 20 years, and you're still paying that off. Was that a good investment? Yeah, it was a good investment, and it was a decent investment. It certainly allowed you to practice dentistry, which is a really good paying profession for that. But you did not pay that off in 5 to 6 patients. I mean, if you get trained in Botox and fillers, 39.97, for example, 5 or 6 patients pays your tuition, and that's it. The rest of it, you're not paying a lease payment. You're not paying a tuition payment for the next 20 years. That nothing pays you back faster than this. And after an AAFE course, you can start treating paying patients in 14 days or less. You got to do some work, but the AAFE will really push you to go ahead and do that. It's exactly the same thing with Gum Builder, as you'll see later on there too. Here are two very disturbing slides from the American Dental Association Health Policy Institute. Like I said, the AAFE partners with the ADA quite often, and on courses and on a lot of other things. We actually have a Gum Builder 1-hour online introductory with the ADA online CE for that, just to give you an idea of how many people are doing Gum Builder now, and since the ADA has a course on it that we did for them. But take a look at this. This is amazing. In 2010, this should shake you to the core. In 2010, the average general dentist was making $267,168. In 2024, that again, this is adjusted for inflation and all those different things. 14 years later, the average dentist is making $207,000. Now, since that, certainly we had the dip in COVID, had a bounce up, but now it's on its way down again. Less patients, insurance nonsense, all that different thing. You need to start looking at things that are really going to drive your revenue. This one is even scarier, especially if you get to my age. If you're a young dentist, 5 to 10 years in or somewhere in that range, this may not bother you. It should bother you, probably bother you even more. What am I talking about? But if you start to be an older dentist here, look at this. In 2001, the average dentist career was 37 years. Okay, that has crept up in 2024 to 41 years. So dentists are having to work longer in their careers because they need the money. Okay, again, this is not me talking. This is the American Dental Association Health Policy Institute last month. This just came out last month. This is not a year or two old. This is literally like last month. You need services that patients are going to pay for, and they're going to pay for themselves. These are the best investments you can make is in yourselves. And now let us get to our topic about black triangles and gingival recession for this. By the way, this is a baby boomer that only has black triangles, very little gingival recession, a little bit around the bicuspids, as you can go ahead and see there. I just want to tell you this. We don't appreciate this enough. We're going to start with black triangles, but certainly we're going to get into the whole Gum Builder technology so you can go ahead and see it for that. Gingival recession is a disease process, not necessarily black triangles, but gums are going to recede. But gingival recession is a real disease process. Did you know, and you can look up these statistics on your own, there are lots of evidence-based studies that show this, that between the age of 18 and 65, 57% of patients have gingival recession. So this is young patients there too. Over 65, obviously, you're up to like 80, 85% for all of that. We mention this to our patients all the time. They are so thankful that there is now a treatment for gingival recession to stabilize and reverse gingival recession. That's not surgery. This is not going to be a knock-on surgery. I do surgery. We actually have a guest periodontist on that we're going to put later on for questions and answers. He obviously does a lot of surgery. I'm actually going to show you a little clip of him doing surgery and using Gum Builder at the same time for all of that. But I want want you to appreciate gingival recession is a disease process. Certainly, it's one of the things that that comes into play when we're talking about black triangles. So we're going to focus on black triangles first, but it's all going to work together for that. Gingival recession, the do nothing is the number one choice of dentists and patients alike, by the way, which is kind of disturbing. Connective tissue grafts, coronally advanced flaps, pinhole, you can do. 92% of patients refuse surgery. I want to do a quick poll with all of you here. Let me go ahead and bring up a poll here that I want you to do. Let's see how you guys come out for this. All right, let me launch this poll. You now have a poll in front of you. Please go ahead and start filling this out. I'm going to leave this up for 30 seconds. So go ahead and tell us, what treatment options do your patients choose for gingival recession? Free gingival graft, watchful waiting, or do nothing. All right, let's go ahead and give that. Thank you for participating. Lots of you are participating. We really do appreciate that for this. This comes out so consistently. I have done this, I can't tell you, dozens and dozens of times. This comes out so consistently. So in other words, when you talk to a patient and you tell them you've got gum recession, go ahead and tell me what, you should get a free gingival graft, or you want to watch, or did they go ahead and do nothing? So you go ahead and tell me. I'm finishing it up. Thank you for everybody participating. 5, 4, 3, 2, 1. That is the end of the poll. Okay, last couple. I'll give you another 2 seconds to go ahead and get in here for that. All right. Thank you very much. That is great. Last ones. Okay, come on. Keep clicking. I don't leave everybody out for this. Okay, that is great. So the results are 51% watchful waiting. Do nothing's 38%, which, let's be honest, that's the exact same thing. Watchful waiting and doing nothing is the exact same thing. Okay, so that is 89%. You're a little higher than most of the times this comes out, but averaging about literally about 50 of these polls that I've done over the last year for this, you come out at 11% chose surgery, but the 89%, generally it comes down to about 8%. So you're a tiny bit better when it comes to that. But let's be realistic. Most patients refuse surgery. I mean, that's what they do, or they're just not going to get it for a whole bunch of things. So what's the option? Nothing. So let's not do nothing. Now there's a real choice to go ahead and do, and that is called Gum Builder, as you're going to see. So I'm going to take you through that. And black triangles, what can you do for black triangles? You can do papillary reconstruction, which is basically a surgery that very few people want to do. Probably the number one thing that people do is composite bonding. You can do orthodontics. You can do soft tissue tunneling grafts. You can do nothing. Or you can use fillers and biostimulatory fillers, which is what we're going to use here, or the Gum Builder technology for that. Nothing wrong with any of that. Nothing wrong with composite resin, right? I mean, nothing wrong with composite resin like this, except when you do these kinds of cases, which is a gorgeous case, by the way. And then put it in the chat. I'm curious to how many of you go ahead and do this. Go ahead and put that in the chat. Everybody can see the chat as it's rolling on any platform where, like I said, we're on multiple platforms here. Do you provide composite resin for black triangles? Go ahead and mention it in the chat. So yes. Let me ask you this question. Is it easy to do? Is this easy to do for your patients here? No, these are very, and again, put it in the chat. We can keep the chat going. It is very difficult to go ahead and do. These cases take, a case like this will take you good 90 minutes, if not 2 hours, something like that. And then how much are you charging for it, by the way, right? I mean, how much to get it this smooth and this nice? How much are you charging? I mean, how much can you reasonably charge for a case like this? Are you going to charge $2,000? Probably not. Is it worth it? Absolutely. Does it become a food trap many times? Yes. Again, I'm not going to knock it. I've done many of these cases. These are hard cases, or like what Shumela says, whatever insurance covers, right? An MLDF. I mean, good luck with all of that for that, right? If insurance will cover it, many times they won't cover it for this because you're not treating caries. years for this. These are very, very difficult cases for that. Again, I've taught it for years, so I know what I'm talking about. Really hard to teach there too. But can you do it in a case like this around Pontics? No way you can't do it in a case like this. So again, composite bonding is a reasonable approach. Orthodontics going to certainly take some time. Or you can go to a non-surgical way, which is what we are going to show you. So when we talk about non-surgical, again, we're going to talk about kind of mix it together, gum recession and black triangles. But we're going to start off showing you a black triangle case and then the combination gum builder and black triangle case that we're going to go ahead and show you here. What non-surgical meaning? A filler into the gums to go ahead and stabilize and reverse gingival recession. I think you're going to be amazed at that versus surgical. And again, I'm not knocking surgical, but very few patients do it. I mean, really very few patients do it. For non-surgical, there's no downtime and minor discomfort. Less cost and time, stabilizes and reverses recession. It's regenerative, so it keeps going. It eliminates tooth hypersensitivity, which is really amazing for that. 78% of these patients accept treatment for non-surgical treatment. That's our statistics and the statistics that we gather from AAFE members that go ahead and do gum builder there. Surgical, downtime and significant discomfort. You got to tell it the way it is. This is all in the informed consent. Significant cost and time. Results are variable. You can still have or cause hypersensitivity, may get worse, may need multiple surgeries. 8% of patients accept treatment. For this big group, it's 10-11%. For a little bit better, it's still a minority of patients by a long shot for all of that. Let's not do nothing, but it is the gold standard. Surgery is great. If you want to get full root coverage, if the case is successful, which it has not always, and again, I've done these cases many times over the years, as have some of you as general dentists or as periodontists for that. They don't always go the way that you want for that, and many times a few years later, you've got to do them again. I mean, so that's it. Here, and this is primarily why. Again, this is, anybody watching that's not a dentist over your shoulder, may not like the next couple of slides for all of that. They usually hate this the worst, by the way, the palatal graft and just as this, the epidermis kind of just, keratinizes over, so to speak, for this. This is like a bad pizza burn for like 4 weeks. They are not happy usually during this time for all that, but it is the gold standard for full root coverage when it works, and it does work when it's well done, but some patients it just doesn't work very well. We can ask our Dr. Valens, our periodontist, a little later on. Non-surgical is going to be a slow regrowth and regeneration of tissue. So they're not the same. They're two different tools. That's what I really want to make this point. You're not comparing one to the other because they're totally different things. Surgical, that's the kind of great result you can get. Non-surgical, it's going to be a slow creep of attached gingiva pushing up and creating not a pseudo pocket. We're not volumizing this pocket for between. Take a look between the teeth on the before and after on the right. That black triangle we're filling by volumizing the tissue, as you're going to see, but around that root where they've had significant gingival recession, they had prior surgery and this tooth just was not doing very well. That's real attached gingival growth, as you're going to see happens on the number of cases that we're going to go ahead see. So they're totally different. One's going to grow slowly. One, you're going to cover it, and after they heal up, they can have full root coverage for that. But offer it to patients, 8% are taking the surgery, 78% are taking the non-surgical approach for that. And then you're always going to have those patients that are going to do nothing. The need is huge. You can think back to the last week of patients and think how many have it. The truth of the matter is, it's really our fault, because when you really think about it, as general dentists especially, we see so many gingival recession cases and black triangles every day as they come through hygiene. We don't even think about it. We think it's normal at that. Many dentists just think, you know what, nothing I can do about it. We're just going to watch it. Patients consider it normal for that. But patients really like getting this treated if you've got a really easy way to treat it for that. The need is absolutely huge. So we're going to talk about collagen and elastin biostimulation and real tissue regeneration backed by science, as you're going to see, with a very high profitability because this treatment only takes a few minutes, and it's really a triple thing. It fills black triangles, it reverses gingival recession and really regrows tissue, and it eliminates this teeth hypersensitivity. I mean, I will tell you that's the number one thing that the patients like the most, because that affects their day-to-day life. Like literally in a day or two after gum builder, their hypersensitivity goes away many times for the first time in years for that. So it's really amazing. So the gum builder shot, non-surgical, it's the number one solution for mild to moderate recession cases. Why? Because you don't do surgery on mild to moderate recession cases. It's the number one alternative to gum graft surgery. I'd rather them do the gum graft surgery, but most of them are not going to do it. Scientifically proven, FDA cleared since 2003. It just pretty much sat on the shelf till a few years ago when the AAFE really put together some protocols. And right now we are in the middle towards the end of a 500 patient study on the gum builder. And the results are fantastic, even better than the results being fantastic, because we're just about to do a halftime report on it through medical statisticians, and are starting to put together some numbers for us for that. The satisfaction of patients is 95%. That is huge. So we know that this really rings true with patients. I'll show you something later. It'll be really interesting concerning patients for this. You'll see it just takes a few minutes to deliver, and it's really, there are very few post-op complications other than a little soreness. So it's really kind of amazing for what you can do. This is just a graphic to show you one thing. What is gingival tissue made up of? The connective tissue of gingival tissue is made up of collagen. So what do we need in there? We need a collagen regeneration agent, and that is going to be a calcium hydroxyl apatite filler by the name of Radiesse. We use it in the face all the time for volume, and it's great for Ozempic patients that really need a lot of volume because it builds their collagen. It really was first FDA cleared for AIDS patients because if you remember, they had all that facial wasting. For that, it is a great volumizer, and it works through calcium hydroxyl apatite, goes into the tissue, and it stimulates collagen and elastin. The body's own collagen and elastin is pretty much how it works, but it is a product that's called Radiesse. It's been around for a long time. Again, if you inject fillers, you may or may not. We train on this in the AAFE in more advanced courses for that, but it is great for regenerating gingival tissue. And here's the mechanism of action pretty much. This mechanism of action is what happens. You put this into the tissue. It's these little microspheres of calcium hydroxyl apatite, which sounds a lot like bone, and it's a synthetic calcium hydroxyl apatite. There's no human tissue or anything in like that in there, with a gel matrix, and that gel matrix is actually is pretty important. It's calcium. It's oh, it just slipped my mind of what it is, but it's it's basically an antibacterial and well, I'm just going to go back because it's going to drive me crazy. It's carboxymethylcellulose, CMC gel. That's an antibacterial, which is really, really important, of an anti-inflammatory. But what it does is it stimulates the fibroblasts. You put this material in to gingival tissue or facial tissue, and fibroblasts start coming in. It creates a scaffold. The fibroblasts start creating the body's own collagen and elastin. Whether it's gum tissue or whether it's facial tissue, doesn't really matter. And then starts to go ahead and mature, and it builds up tissue. And that's the amazing thing. So it's a slower process, but that's okay. We're not in a hurry because we're going to get real gingival tissue, as you're going to go ahead and see for this. This is the FDA clearance since 2003, and it is cleared for a whole bunch of things. I had to cut it off because it wouldn't all fit on the page. But the number one thing is periodontal defects, as you can see right there. That's exactly what gingival recession is: ridge augmentation, extraction sites, and everything else. I mean, it's used not just in the face, not just in the mouth, but certainly is used in the face and anywhere where there is bone on the body as well. So it is a very, very it's a great agent to go ahead and use this. But instead of talking about it, let's show you. I want to show you this first case, and this first case is going to be just a straight black triangle, which is going to be about volumization. I just want to make this point because it's really important. Volumization is for black triangle. Why? Because you've lost volume between the teeth. You've got to plump up that tissue to go ahead and fill the void and take care of that black triangle. That's what you're going to see in this first video. Then we're going to show you a second patient where we did gum builder for gingival recession and black triangle together, and we'll show you a bunch of before and afters too. I am going to turn off my video here, and here we go. First video, here we go. Now let's go ahead and treat Shani for some black triangles. The first black triangle we're going to treat is between this cuspid and the lateral incisor. And this is, you can see, she's had deficient volume between those two teeth. She's got a couple others we're going to treat, including the one right between the central incisors. But take a look at the other cuspid, between that cuspid and lateral incisor. You can see there how that is naturally filled up. So she's got at least two black triangles. We're going to start with those. We're going to treat this a couple of different ways. Black triangle technique you're going to see is obviously much different than gum builder. We're going to use two different materials. First one we are going to use is going to be the Kaha material that we use for black triangle, but now we're going to use it for volume. Let's look at the technique. We are now in the papilla. And that is going to go ahead and we're going to go back and forth, back and forth, back and forth a few times because we are looking to create some space in the papilla so that we can place the Kaha material, the calcium hydroxylapatite material for volume now. That's what's different than the gum builder technique. Gum builder technique, we want Kaha microspheres in the tissue to get collagen biostimulation. Now we want volume. So we are going to now add some volume. We're going to create a little bit more space. And this is also developing a feel. We're using the tip of the needle as a little scalpel internally, staying in the papilla here. And it's going to bleed, and especially if it's going to bleed because we just did the gum builder technique on her. So this tissue is really kind of beat up a little bit. Now we're placing the Kaha material with volume, and you're going to see we're going to get quite a bit in there for volume. If some of it comes out, that tells us when we have added enough, and that was good volume just in that one injection because we had already created some space. And that is the whole point of what we're going to do. And it's fine that it bleeds. And again, especially for the Kaha material, because as it mixes, the blood mixes with the Kaha material, that stimulates the collagen. But here we're going for volume. So we've got some good volume in there that we are shaping with a cotton swab. And then we are going to go ahead and put our finger into her mouth and support the lingual part of this. So now as we go ahead and place more volumizing Kaha material, same material, just using it for its volumizing abilities. Now we are going to go ahead and my finger is against the lingual and it is going to trap it so that it is not going to come out the lingual or push the tissue out, volumizing it towards the lingual. I wanted to volumize it up, and then we are going to go ahead and shape it again. Keep adding as we need to try to get as much as we can. As soon as it starts coming back out, or I feel like I just can't get any more in there, then that is when we are going to stop for now. And this may take 2 or 3 appointments. It just depends. Now, she's coming back anyway because we treated her for the gum builder technique. So that is going to be just perfect here. And then we're just going to kind of feel our way around, see how much volume we got. We did get some significant volume there. That is looking pretty good. Now we're going to go ahead to between the central incisors. But here we're going to use a different material. Here we're using a hyaluronic acid jelly material, and that is a dermal filler here. And this is going to be a medium or medium to heavy dermal filler. Same technique. I'm creating space. You see, I'm going back and forth in that papilla. What I'm doing is creating some space using the tip of the needle as a little scalpel, and then we are going to go ahead and add some volume with the hyaluronic acid, medium to medium heavy the dermal filler, and that's what we're going to do. And you can see that is starting to now volumize and starting to creep up. Here it's a little bit easier to see some of the material is going to be coming back out at us, and that's telling you that's all this tissue can take for right now. Once it sits in there for 2 to 3 weeks and the tissue goes ahead and expands, then I can come back a second time and do the same thing, and then I'll have more expanded tissue and it can accept more of the material here. You see my finger is in the back, and that is, again, supporting the lingual so that we are not going to get a projection or the volume going towards the lingual. It doesn't do me any good there. I want it to go up. It may not completely go ahead and close the space in one appointment, maybe not in 2 appointments, but it will definitely be closing the space a lot more. And it has already, if you can go ahead and start to see this. Again, now here I'm adding some more of the filler in there, and it's coming out. And when you see it come out, that's all it can really accept for this appointment. Be patient and give it some time. This may take 2 or 3 appointments to really go ahead and fill up this black triangle. And again, we never promise the patient that it's going to be filled completely. We are going to go ahead and fill it. It'll definitely be better than we had it before. There you can see the immediate after. That looks really good. So we'll see what this looks like in a couple of weeks. All right, so let's take a look and see what this looks like. It's going to be pretty incredible what it looks like. I mean, this is her. This is shiny. Let me go get my video back on. So there you go. For that, I mean, you can really see the before and after. But she did have gum builder too. We'll leave that for another time on her case. But you can see that these black triangles are really, really closed up. And these have held. I mean, we treated her about 1.5 years ago, and she's a wife of a friend of ours, and she is doing just fine. Black triangles, when you fill them, they seem to really hold for a long time. Now, many fillers, some fillers will last 6 months, some will last 12 months. This filler actually will last a pretty long time when it's used for black triangles. So it's pretty impressive. And again, I can show you hundreds of cases by AAFE members and by our own team here, but this is a very easy case and a very common case. I mean, you see this all the time. Now, what are you going to do with this? Are you going to go ahead and you could add composite, make the teeth look a little bit fatter on this, or you could bulk up the tissue and then leave the teeth exactly in the shape, which the teeth are a very good shape. I mean, there's no question the teeth are a very good shape for all of this. I mean, again, I'm just showing you a very simple case. There are dozens of these cases for that. I mean, literally dozens of cases that walk through your office all the time. It could be 1 tooth, it could be 5 teeth. It really doesn't matter. What do we charge for this? We're going to go through charges a little later on, but for a black triangle, something like this, we can charge $200, $300, $400 for each black triangle. Just depends on, it's pretty much open for all of this. It doesn't need to be redone at certain points like Botox. Botox is every 3 to 4 months. This, it just depends. These really can last a year and a half, and then we may need to add a little bit more volume at some point to this. We are using, we'll show you this a little later on, a 29 gauge needle. It's called a ComfortTax. I'm actually going to show you that next. ComfortTax needle. They come in specially designed. I'll just show you to you now. 29 gauge needle by ComfortTax. This is the best needle for placing Radius, and we use Radius. You can use, those of you who know other fillers, you can definitely use other fillers. Hyaluronic acid fillers like your Juvederms and that kind of stuff. They're typically not going to last as long than that. They usually break that in about 6 months. They usually last a little bit longer, but you can get these. These are the best needles. We use this for all of our Botox injections, for many filler injections, but for this specifically, and we're going to show you a gum builder and black triangle case like I described, specially designed 29 gauge is by far the best. They're also the sharpest needles. This is why we only use these in AAFE training for Botox injections. You can see how sharp they are. I mean, that's a ComfortTax right out of the package, put right under a microscope. Super sharp technology, multi-bevel sharpness, and a not ComfortTax, which is another very well-known, popular syringe. insulin syringe, and it's ragged and it hurts and it tears up tissue. That's not something that you want. All right, let me take some questions for now. Training questions. Go there. Go to aafedentist.com for training questions. Grab one of these packages. Again, I'll get a little bit more into this a little bit later on for this, but let me answer some questions now. Let me just look at the different platforms and see what we got for questions. So let me just take a minute or two right now, and then we will continue on, and I'm sure you will have more questions. There's no question about that either. Okay, can you use any HA filler? So yeah, you can use any HA filler. You can use a Juvederm, you can use a Restylane for that. What density should it be? A medium filler. I wouldn't use anything more than a medium filler because you don't want to blow out the tissue. Exactly what will happen. The tissue can only hold so much filler when you're doing it for black triangles. When it starts to come out of the hole that you're trying to fill, then pretty much you are done at that time. Many times, if that's not enough, patient wants a little bit more, you would wait a couple of weeks, because what will happen? You're putting this filler into the tissue and that tissue is going to expand. If you wait a couple of weeks, then you have expanded tissue. You can actually get in a little bit more. You know you're done when you keep squeezing stuff in and it keeps just coming right back out at you. We do hold that lingual, as you saw, because I don't want to fill up that gum tissue and then create this bolus of going into the lingual, going into the mouth for that. So we really either keep a finger or a Q-tip against the lingual tissue so that when you're filling this up, it's going up and not going, pushing the tissue into into the lingual for that. Local anesthetic for these procedures is infiltration, usually just labial infiltration. You don't need to do. You can do lingual infiltration. You can go right into the tissue for that. Remember, this Radiesse has got lidocaine. So after the first couple injections, that whole area is going to be numb for that too. But we usually give them a little bit of an infiltration. That's all they need for that. Do you recommend ortho before gum builder treatment? It just depends on where they're at. I mean, we do gum builder treatment during ortho. If we really want to stabilize the tissue for that, we'll do it before, during, or after. A lot of it happens after, that's for sure. For that. Insurance coverage for black triangles, not so much. For gum builder, you will see later on. We will show you insurance coverage for that. Let me take a look. Risks of negative reaction from the procedures? Never. There's never a negative reaction from the procedures. The most you'll get is a little bit of soreness. You're not really going to get bruising because gingival tissue may bruise a little bit, but you're basically never going to go ahead and see it. We're going to talk about how much is Radiesse. We're going to talk about patient fees. Hold on for that. Are you pulling the filler from one syringe for multiple patients or visits? Yes. It comes in a big syringe. We are going to backfill ComfortTox syringes with this using sterile technique. You learn that all in the course, and that's exactly what you're going to do. Comes in a 1.5 ml syringe, and you're going to fill up those smaller ComfortTox syringes, which about 0.1, 0.15 for each syringe, because that needle tends to get dull over time for that. No allergy concerns. We've never had anything like that. It's very low on the allergenic scale. It's calcium hydroxylapatite. I mean, they'd have to be almost allergic to their own bones. And CMC, the carboxymethylcellulose, has a very low, we've never had a problem with that. Let's see. After you backfill, you're going to use the original syringe. As long as you're using sterile technique, you've got weeks. But it shouldn't be taking you weeks. I mean, people are going through gum builder like crazy. Shelf life is whatever it is on the box. Generally, it's 2 to 3 years of the master syringe that it comes out of that. What does it do to pocket depths, and what is recommended to keep those areas clean? Flossing, which they never do, and brushing, whatever you would normally do for that. The black triangle doesn't really increase the pocket depth because again, we're just taking tissue and we are building it up. So that's not going to be a problem for that. Gum builder is not causing anything. I mean, you're moving the entire apparatus up. So it's not, you don't get a pseudo pocket on any of these for that. We were worried about prolonged blanching and necrosis of tissue. No, because you would have to cut off the blood supply, which we are not doing. If anything, with this regeneration of tissue and the whole neocollagenesis that happens, you are getting increased circulation over time for that. How long visits for patient per how long between visits per patient for one site? For many times we're done on the first appointment, and if we need to go back and do more, we'll wait at least 2 weeks for that. A water pick immediately after and later on, not a problem as long as it's not on the highest setting. All right, I'm gonna go on because I want to show you a gun builder technique and keep asking questions because we are going to I want to show you the combined patient, and we'll keep answering questions for all of that. Yes, go here. This is, and congratulations, about 6 or 7 of you already snapped up, this package of $39.97. This is the only investment you're going to make that's going to pay you back. That literally will pay you back the first 14 days or the first month of treatment when you go ahead and do this. Implant training doesn't do it. Ortho training doesn't do it. Nothing is as instant as Botox and fillers when it comes to paying you back, because these patients are already getting it somewhere else. They'd rather get it in your office and pay you because they like you. How do I know they like you? They keep coming back to you for cleanings and whatever else. They trust you the most of any healthcare professional. I mean, it's really incredible. Gum Builder too, that $15.97. If you just do the live Gum Builder certification or the online Gum Builder certification, your first 2 cases pay off your tuition. I mean, this is really incredible for that. The all-in clinical package, what live patient courses are included, whatever you like. Our level 1 Botox, level 1 filler, level 1 TMJ. You can do the level 2 if you've already taken the level 1, level 2 Botox, level 2 filler. Any of our live patient courses for injectables are all included for all of that. And Haley, thank you, is here to answer questions there too. Here are a little closer up. If you want to see the bonuses of the all-in package, $39.97. That is 3 live patient courses. Again, you would normally pay a couple $1,000s more. Plus, you're getting all of these bonuses that are only available here. If you wait till tomorrow, these bonuses are gone. Then whatever's on the AAFE website or whatever their Black Friday specials are. None of their Black Friday specials have these bonuses. So it's really, if you want this, lock it in. And again, you don't have to take these courses next month. You can take them next year sometime. I wouldn't wait because this is literally money in your pocket. But we will get you started within 14 days after taking the course. We're going to need your help because you're going to have to do it. But the AAFE will push you to really start getting this into your practice. So this is a tremendous value that you will not find on the AAFE website. You're only going to go ahead and get here. So it's 3 live patient certification courses, which could include the live patient Gum Builder if you want. But typically, most people, especially if you've never been injectable trained, are taking level 1 Botox, level 1 fillers, and level 1 TMJ, oral facial pain trigger point therapy for that. Then you can add on the live patient Gum Builder because they have these weekends where you can take all 4 courses to really minimize your time out of the office. The AAFE, those of you, and congratulations, those of you who grabbed this package, AAFE will get to you tomorrow morning. First thing, get you started. Get your location, and really push you to get going as quickly as possible. How popular is Gum Builder? Let me show you this for this, and then I'm going to show you a Gum Builder technique, which is going to be different than what you just saw for black triangles. This is a great AAFE dentist, Dr. Eris Cohen, for that. Ladnap dentist. He's been doing a lot of gum treatment, and he does a lot of dentistry, a lot of gum treatment. But he started. Look, I just want you to realize one thing. A little lesson in social media today. He's got 4,500 followers. That's a good amount of followers. Okay, for that. But now, take a look. It's not about followers anymore. It's about the content. That is where the algorithms are going. How good is your content? How interesting is your content for that? I want you to take a look. He called us up a few weeks ago. He got trained in Gum Builder. He got trained, I think, with Dr. Valens because he's in New York with that. And you'll meet Dr. Valens a little bit later on. He started posting Gum Builder videos on his Instagram page. Look at this, 60,000 views. This one is something else that he got 13,000 views. His normal views, I'll show you on the next page, next slide, are 2, 3, 4,000 views of each, one of his reels or whatever. This is a Gum Builder, 320,000 views. He called us up. He said, I don't know what is going on, but every time I post about Gum Builder, okay, and for early recession, as you can see right here, it explodes. Look at this. And here you can see some of his normal views on his Instagram page, 3,800, 7,700, 3,800. Gum Builder, $276,000. He says, I don't know what's going on. I said, that's how popular it is with patients. Another one, these are not the same. This is 276. This is 274,000. He's gotten almost 1 million views, okay, for Gum Builder posts that he put on there. I don't want to show you his whole page. That just takes too much time. This one is 81,000 views for this. His normal ones are 2,600, 3,000. This is wildly popular. I was on a phone call today with a group that and I was talking about this, and they, like the lady said, I'm getting on a plane tomorrow to come see you, come see you for that. I mean, it's really just gone crazy for all this, which is great. I mean, that's exactly what we want. I mean, literally, it's exactly what we want for this. So let me just go ahead. And hang on, I just got to get this one platform going again. I mean, that's how wildly popular this really is. So that is really a great testament to what is going on. Now let's show you Gum Builder and black triangles here. This kind of a case you see all the time. Look how raw this tissue is right here, and that's what happens. This is a couple of weeks in. This is a month in, and this is what I want you to really appreciate. Look how this tissue is going ahead and really just incredible how it's really starting to grow. And this is a month in. First of all, tissue looks much, much healthier right there for that. That's really incredible. Is it total gum growth and total coverage? No, it's only a month in. This is going to take time. Will it ever get to total? I don't know. But I can tell you it's going to get better and better over time. It'll probably get easily halfway. Is that better than doing nothing? Absolutely. It's real treatment. Will gingival graft surgery give you total coverage? Probably, yeah, but they don't do that. Okay, they just don't do that. So what am I supposed to tell you? I mean, they literally just don't do that for that. So that's really what we're talking about here. Let me just get this going here again, and let me get that platform going. All right, let's go ahead, and you can really see, but not just that, it's black triangle. So many of the cases we do are the combination of black triangle and also together with Gum Builder. So that's exactly what we're talking about. I'm sorry, hang on a second. Let me go ahead and show you now a Gum Builder video on this next patient, and then I'm going to show you the patient's reaction too, which is really amazing.
There is a very common patient that walks into your office every single day. Black triangles and lots of gingival recession and lots of hypersensitivity because of those exposed root surfaces. You see this all the time. Now we have something where we can really do something. Here's more of a frontal view of that same patient. And you can see this is from mild to moderate to some of these are severe. She does not want surgery. So let's go ahead and show you Gum Builder and black triangle treatment together. And let's go ahead and show you. Let's get with this right now. This is actually her second treatment, and this is after we've anesthetized the patient. So you will see This is much healthier gingiva than we started with at the first appointment. So I want to show you Monica's second appointment here, and you can really have a good idea. Compared to the video, to the photos that you just saw of her, this is much better quality attached gingiva, and also it started to creep up a little bit. And you'll certainly see this in the before and afters as we go ahead and show you. So what are we doing? We're putting some calcium hydroxylapatite filler into the split thickness of the tissue here in the attached gingiva for collagen biostimulation. That's what we're doing to get even more. And again, because we're treating this again at the second visit, we want even more collagen biostimulation. So it's going to continue on from the first visit, but now we're doing this on the second visit so that we get some substantivity of that collagen biostimulation that will now last for a few months. Get more attached gingiva, it'll start to creep up even more than it's done in a short 1 month treatment from its first treatment here. So you can see, now this is gonna bleed. I mean, this is always a fairly messy procedure. I would say it's not the prettiest procedure, but this gingiva is actually much healthier than what we did here. Now, these are the areas that we are going to go ahead and also treat for black triangle. We'll show you that. That's a separate treatment here. All we're doing here is we are using the tip of the needle to go right underneath the gingiva, into the attached gingiva, not down to the bone, and we are delivering some seeds. We're not volumizing. We are delivering some seeds of this calcium hydroxylapatite CAHA material into the tissue here. That's going to do a couple of things, and that is going to give us collagen biostimulation, but also it's going to release calcium on a constant basis, calcium ions through the tissue to those exposed root surfaces. By the way, because this is her second visit, her hypersensitivity was gone after a few days of her first visit, and that's really the amazing thing. Some of these were sensitive. Some of these teeth were not as sensitive. You can most certainly kind of guess which ones were and which ones were not here, as you see here. Now, if you put too much pressure, you will get clogging of that tip, because these are little tiny microspheres, but we're using a 30 gauge needle. This happens to be a little bit of a longer needle. Doesn't make a difference if you use a longer needle or a short needle. Why am I using a longer needle in this case? Because that's what I found on the shelf, and I was ready to go with the procedure, so we backfilled some of this with the calcium hydroxylapatite filler to go ahead and do this. But if you put too much pressure, if you go too fast, then you will get clogging of that tip. So there is a little bit of a learning curve that you need to master. Once you master it, you can see this goes fairly quickly around each tooth. We go ahead and go from anywhere from 3 to 5 areas per tooth, starting with in the papilla, halfway down between the papilla and the apex, and then at the apex, and then work our way up to the other tooth here. We generally go with a healthy tooth on either side. Here we're just going from cuspid to cuspid. We'll go back later and treat some of those other recessed areas on the posterior teeth. Much easier to see these on this patient here. Then we go ahead, whatever's left in that syringe, we don't waste it. We're going to go ahead and really drive some of this calcium hydroxylapatite, these microspheres, into the recessed areas of the teeth. Why is that? Because this is going to keep the elimination of that hypersensitivity, literally plugging up the dental tubules. Calcium is by far the most effective way to go ahead and do this, by pumicing this right into to cover those dental tubules and create the plug. But the constant release of calcium ions from the tissue, that's what gives you long-term hypersensitivity, and it is just amazing here.
All right, and so let me just go ahead and go to the next video, because it's going to be on this same patient. I didn't show you all her treatment, but I showed you some of it. And now on the same patient, black triangle, all in the same appointment. Here we go.
Now it's on to black triangles. Take a look at the technique. This is different. This is going in there using the tip of your needle as a scalpel. Look at that back and forth motion. What are we doing in the papilla when we do that? We're creating space. Now, this is the second treatment for black triangles on this patient here. And she already has a lot more papilla to work with, which means we're going to get an even better result as we volumize this. And that's what we're doing. We are placing some of the calcium hydroxylapatite. We're using this. We can also use hyaluronic acid. In this case, we're just going to use what we've been using till now. And now we go back and forth, back and forth, back and forth. Add some, it'll come out that same hole. That's how you know that you are, that it's filled as much it's really going to go ahead and take. And we're going to go back later and see if we can add a little bit more, and then we are going to shape it. Notice the Q-tip on the lingual here. That is to prevent it from going out the lingual, more than going out the lingual, from volumizing that out the lingual. Now let's go to the next one. Same thing. We are going to go ahead and go back and forth, back and forth, back and forth, staying within the gingiva and creating some space. That's exactly what we're doing. And then we are going to go ahead and use some of this calcium hydroxylapatite to volumize. In this case, here we're placing that Q-tip on the back of the lingual, putting pressure on the back of the lingual papilla so that it's not going to push the lingual papilla out. We don't want that. We want it to go up. And that's exactly what we're doing. You can also go ahead and go bevel up and also angle up a little bit, because that's the direction that you want to go ahead and fill this. So we want to do this. We don't care if some of it comes out. That's okay. That just tell me it's not going to accept any more of this right now. And then we are going to go ahead and start to shape this. And again, keep that on the lingual. So we go ahead and really push this in there and really start to shape it. We are putting a lot of pressure on that filler to keep pushing that papilla up. That's what we want to go ahead and accomplish this. It's fairly simple treatment once you get the hang of it, like anything else, and understanding how you can really close up black triangles. Now, first time we used actually calcium hyaluronic acid on that second papilla right here. We're going to see if we can get a little bit more in there. It's okay to use hyaluronic acid. On the first, second appointment, we used that very, very successfully. You can mix and match. This time, we just had the calcium hydroxylapatite ready to go. The Kaha filler, and might as well just use that. So you can certainly mix and match and get good results here. Now let's show you again where we started, and this is her at baseline. You can clearly see those black triangles, but also take a look at all that recession and the very thin attached gingiva that she had that we started with when we first started her treatment, and the hypersensitivity, it certainly comes along with it. That's really thin attached gingiva. Now let's show you the after and take a look at those black triangles that are really successfully closed up. But look at how much more attached gingiva there is on this patient all the way around. And specifically, take a look at some of the recessed areas that have really started to close up or are really minimized, because that attached gingiva not just growing up to cover the recessed areas, but is also growing down towards the vestibule. So we have a much, much better attached gingiva, the quality and the quantity of it and the height of it there as well. And here you can really see with those arrows what we have done. Look at the cuspid on the one side, and you can clearly see that that recessed area is gone, and she's got a lot more attached gingiva everywhere. I mean, you can see it, and then look at the black triangles. Those are really, really covered up. And with the second treatment, this is just going to get better and better. But again, want you to really appreciate, especially when it comes to the central incisors, for example. That's a lot of recession that she has had there. Look at the before and after. And if you look carefully at the before and after, you can see she's gained a couple of millimeters for sure, at least, on all of these teeth, but specifically around the central incisors, because it's hard to tell the difference, right? Because she's got so much recession there. But if you look closely, this is starting to happen for her. So with the second treatment, with continued time for collagen biostimulation, and she is going to get some root coverage. Now, how much? Only time will tell for all this. But as the alternative to surgery, or as the number one treatment for gum recession, mild or moderate for sure, and even for severe recession, you cannot beat the gum builder. Now, she can always go back and have surgery later on, without a doubt, have that at any time. Why she would want it now? Who knows? Because this treatment is working very, very well for her. You need to offer this to your patients. And when you talk to patients about gingival recession, hypersensitivity, black triangles, you've got to put gum builder into the mix, because that's proper informed consent. Compare it to surgery and give everybody the risks and benefits for both. It doesn't make a difference to me what they pick, because I do surgery there as well. I mean, so we can deliver all of that, but you've got to give a patient all of the available options, and they love the non-surgical option. So it's time for you to get AAFE certification trained today on gum builder and black triangle treatment.
All right, I just want to show you again. I'm just going to show you her before and after so you can go ahead and see it. But I want to show you her reaction, though, which is really, really incredible. So here you can really see beforehand. And again, she put off surgery for a long time for that. 2 to 3 millimeter increase. We were talking about in a 2-month period of time, and it's only going to get better. But I want you to hear from the patient what she has to say. And then we're going to get your questions ready for our periodontist. We're going to bring them in just a couple of minutes for that, so you can ask a periodontist questions for all of that. And he teaches this, and he gets a lot of he teaches a lot of students on this. He also does a ton of Botox and fillers in his own office for that. But what this patient that we just treated, well, I want you to see her reaction. Here we go.
Monica is here. She has had 2 gum builder patients according to our protocol. So we're going to go ahead and take you inside of her mouth here and take a look at her gums and see the results. And they are quite amazing for that. But before that, Monica, let me just ask, and you see we're all bundled up because it is freezing in Cleveland today. Let's go ahead and let's get your perspective of this. First of all, how was the treatment in general? You had 2 rounds of the treatment.
I thought it was very simple, easy. I had no problems, no pain. For myself, I thought I immediately saw a difference.
Right.
They're pink. They're nice and pink. And
right. I mean, is that what you noticed? That's what you mostly noticed.
And I noticed that the teeth that were the worst, the front 2, I noticed right away that you could see a little bit of change.
Right.
Yep.
Right. So she's had various teeth that, the 2 front ones had the most recession, but we've seen some improvement. Sensitivity, tooth sensitivity,
Nope,
nothing. So that all that is gone. And she also had some black triangles. She had, because of all that recession, it kind of opened up these black holes between the teeth, where you trap teeth, trap food, and trap different kinds of things. So that's closed up substantially. Now, we did gum builder and black triangles on her, but are you happy with the treatment, bottom line?
Happy. And I told the girls last week when I was in, I've even started telling friends and people that they should do it instead of alternative things.
Right. And again, just to remind everybody, you were told to have surgery.
Right.
Many times over the years.
Surgery and
you didn't.
Another, and I didn't.
Right.
I'm glad I didn't. So.
Yeah. All right. So it's a great alternative. But let's go ahead and take you inside and see the results after 2 gum builder treatments. And this would be about 3 months out. It's been about a month since her second gum builder treatment. So come on in. Let's go ahead and show you.
So you've seen the inside because that's just what we show. I just want to show you a couple other, before and afters, and let's talk about patient fees. And then I'm going to bring in Dr. Valens here. I mean, and some of these are from our study that we've been doing. Again, if you didn't hear me say it before, we're doing a 500 patient study on gum builder right now, a real study. It's on clinicaltrials.gov. This will be a published study by the time we're done with it. We've got a few more months to go, but I mean, this is total closure of gingival recession. As you can see, easy case. So this is a great case. Why should you wait for this to get worse instead of, because this is one of those cases where nearly every dentist and many periodontists are going to say, yeah, don't do anything, just let's watch it. Watch it do what? It's only going to get worse. I would ask every dentist on here, have you ever watched one get better? Has it ever gotten better by itself? No, it never. It only gets worse for that. So these are the kinds of cases that are home run every single time that you have hundreds of in a week if you're looking at hygiene for this. And now you're going to look at hygiene totally differently. This is a great case. Take a look, that significant amount of recession on there, and look how much that's happened. That happened in 2 months. 2 months that gingival growth for that. When you probe it, it is a 1 to 2 millimeter pocket. This is not a pseudo pocket. This is real attached gingiva that grew up, that grew underneath this and pushed everything up. That you're getting real regeneration of this, and it will keep growing. That's the beauty of all of this here. And again, I could show you hundreds of before and afters at this point in time with the thousands of AAFE dentists who are doing gum builder right now, and periodontists as well. This is real, and you've got to offer this to your patients. And let's talk a lot about the financial impacts for this. And that is going to be, first of all, where do you get it? You get the Radius and the Radius Plus from StatDDS. That's the name of the company that has, it's the exclusive distributor of Radius for the dental industry. So it's the only place you can go ahead and get it. Each Radius Plus box comes with 2 syringes in a box. Each syringe, okay, so 2 syringes in a box. Each syringe costs you about $385 for a 1.5 ml syringe. Treats anywhere between 20 to 30 teeth. Your cost, a typical cost for the Radius per tooth is about $12 per tooth. You're going to be charging $125, $150 per tooth. So that is significant ROI. Syringe is approximately, the syringe cost is $385. Typically, it can give you about $3,700 in production for that. And even if it's $3,000 in production, that is really, I mean, that's almost a 8 to 10 times return on the cost of the syringe for this. This is by far the highest ROI based on time and product that you have anywhere in dentistry, by the way. There's no lab fee, right? There's the time involvement is minimal for this. We could do this all day. And let me tell you, and again, Dr. Valens will be able to talk about this in a couple of minutes here too. Your first 2 cases easily pays your course tuition for that, for the live patient training, for the online training, whatever it is for this. Suggested minimum treatment fee is $125 to $150 per tooth. I will just say this at this point, is that there's no such thing as a 1-tooth case. If 1 tooth needs it, and we showed a couple of 1-tooth cases before, 1 tooth needs gum builder, we're always treating a healthy tooth on either side. So the minimum number of teeth is always going to be 3 teeth for this. If I have 4 teeth that have recession, I am treating 1 healthy tooth on either side. So that's going to be 6 teeth at about $150 per tooth. The cost per tooth is about $12. The time involvement is going to be 10 minutes. If that, you can charge a per area fee for this. It's a comprehensive treatment fee with other treatments. It's the highest ROI that you've got. Dental insurance does cover it. Not all dental insurances, but more and more are covering it with a UCR of anywhere between $100 to $150 per tooth. So they can get coverage for that. AV members, some of them are doing up to $30,000 a month just in gum builder. Aside from Botox and fillers and all the other stuff that's going on there. The codes will not help you by themselves, but people ask me all the time about the codes because you do have to have descriptions and you need that information that you'll learn in the course. But these are 2 of the possible codes that you can use. I actually spoke at the MetLife Dental Advisory session. They get their dental advisory board together like once or twice a year, and I spoke last year to them. I presented on this and Botox and fillers and that, and they said, it depends on the employer and depends on the contract, but many times they will go ahead and cover it. You all know MetLife, love them or hate them, but they are one of the biggest dental insurance companies that are out there for that. So you can, or you can tell the patient to pay you and just give them just give them the form and let them go ahead and submit it, or you can submit it for them, whatever, basing on what you do. But it's not every dental insurance, so they're ultimately responsible for all of that for this. So just to kind of circle around, and then I'm going to bring Dr. Valens in on this. So please ask questions. We've got a real periodontist for this. Add that onto Botox and fillers, and you have got a lot of production that will rival your dental production right now, just in injectables, whether it's in the mouth or in the face for that too. Botox and fillers, again, your investment will pay you back with your first 5 to 6 patients, and we will push you to get started if you train with the AAFE. No one else will do this because no one else has the resources to really make you successful with this. We want you treating paying patients in 14 days or less. After a gum builder course, you could treat it the next day practically. I mean, all you got to do is just order the filler and the syringes, and you are pretty much ready to go. AAFE offers production study for Botox and fillers. Again, we survey AAFE members about a year out, and AAFE dentists who add Botox and fillers to their services are seeing $32,500 a month in additional production on average. Some are doing less, some are doing more. If you add TMJ to the mix, they're doing upwards of $52,000 a month, in addition to any other dental production that you do right now. But there's no lab fee. Again, it's your skill. That's what you're investing in for all of these different things here. So let me bring in Dr. Valens. I'm going to unmute you, Neil, and then we're going to get some questions. I do want to show you this. I want you to tell us, hang on, let me just see how I do it. Okay, I'm going to ask you to start the video. So Neil, on your end, see if you can start the video and see if you can get on video and see if you can. Okay, you should be able to talk.
You can hear me now?
Yeah, and we can see you. That is fantastic.
Okay.
That's fantastic. But before you do anything, Neil, I have that little clip of you doing gum builder during surgery. Can you want to take everybody through it? I'm going to show right. I mean, it's about, I don't remember. It's not even a minute or whatever. But go ahead and tell us what you're doing here. You see it?
Yeah. So in this particular case, we find if we do gum builder during periodontal surgery, we can prevent recession that usually develops because of the periodontal surgery. So I found usually after surgery, we get recession and sensitivity. If you do gum builder right after surgery, you can prevent that sensitivity and you can prevent any recession from developing. It's very, very useful because surgically, we always have sensitivity. This is a great way to prevent it. Gum builder can be used. There's a lot of applications that we use it for. It can be used when you insert a new crown and you get that little black line. You can do gum builder around that to prevent recession. I do it on orthodontic cases in areas that I anticipate recession to develop. So it's really, or I do it around implants. It doesn't only have to be around areas with recession. It can be around teeth where you anticipate recession. So it's really, really great. I've never seen anything like this. This is a gift to dentists. You know how hard it is to be a dentist and what we go through. And God gave us a gift. This is a painless, easy, lucrative procedure that you can do immediately because you have these patients in your office right away. It's not like you have to wait for Botox people or filler people to come in. Monday morning, you go to your patients and you already have 5 or 6 patients with recession right away. It's really great.
Right, and I really should do a proper introduction. Right. Dr. Neil Valens has been a periodontist for how long, Neil?
Too long, 40 years.
40 years. And his practice, okay, just to let you know, his practice, it's really, I always find it's really amazing. His practice is on 5th Avenue and 61st, right? You're still in the same office building.
Uh-huh.
Okay, I mean the museum isn't a museum, art museum, like right there, Museum of Modern Art.
It's about 6 blocks up the road.
About 6 blocks up. He is in a building. What's always fascinating to me about, and Neil has been with the AAFE, he's an AAFE faculty member on Botox and fillers and advanced courses for this. He teaches this for the AAFE as well. But he does a ton of injectables in his office. He's a periodontist in an office building. How many plastic surgeons in your office building?
About 8 or 10.
8 to 10. Okay, so
Yeah.
it's 50. If you know anything about New York City, like California, people come for aesthetic treatment. He's got 8 to 10 plastic surgeons. Any dermatologists in your building?
Yeah, it's about 5.
Okay, so and he's probably doing more injectables in his office than most of them are doing. That's what we're talking about here. That's really incredible here. There's going to be a lot of questions about training, so I'm just going to skip to training this, and then we'll go backwards here again. Those of you who keep asking about now's a good time to go to this, but we're going to ask some questions of Dr. Neal. Please ask questions in the chat. I've got some questions that are coming in different platforms for this. He's a real periodontist and been doing this for a long time for this. So again, your training options are the all-in package. 20 of them, I think probably 12 to 13 are already gone. So if you want it, you want to go ahead and grab this. Comes with all these bonuses. I'll go through these again. And then if you just want the live gum builder certification, Dr. Neal has got courses coming up. I'll have to bring that up again. I think, do you know when your next course is?
December 12th, Friday, December 12th.
So again, that's in his office in New York City, and he gives them regularly. He's giving them first quarter of 2026 for that. So if you only want that, if you want the online certification, you can go. But there's nothing like live patient, that's for sure, for that. So let me get to some questions for you here, Neal.
Okay.
Let's take some of these for this. What are hyaluronic acid versus CAHA, HA versus CAHA filler risks versus benefits for gum builder and black triangle for that? Just talk about risks or complications. What have you seen with gum builder?
I've seen 0 complications. 0. Patients love it. When a patient comes to your office, what's the first thing they're afraid of when they have recession? How many times do you hear from a patient, am I going to lose my teeth? And they all, as dentists, we've convinced our patients through the years, for better or for worse, that if you have gum recession, you're going to lose your teeth. And I get referrals from general dentists all the time, and the patients come in and said, my dentist said I'm going to lose my teeth. So the biggest thing you're doing for gum builder is you're alleviating the fear that a patient has that now they're not going to lose their teeth. So that's a big, big, huge selling point. And the way I work it, when a patient comes in and they have recession, I say, we've been watching this for quite some time. We now have a method, a non-surgical method to treat recession. And every single patient across the board is interested. And I said, I get 90% acceptance with it. Most of them want to do it immediately. As soon as you bring it to their attention, hygienist does the recall. They say, can we do it now? I have my assistant backload the syringe, and 3 minutes later, I'm doing the procedure. I give a little injection at the base, which is very minimal. There is 0 pain, 0 post-applications. I must have done 10,000 teeth, and I have not one post-application complication on this at all. 0.
Right. And obviously you still do surgery as we
Oh, yeah. I mean, if there's a mucogingival problem, you can't inject into mucogingival tissue. If they have a 7 or 8 millimeter recession, you got to do it. Gum recession is only treated, to me, if a patient has extreme sensitivity, if it's a cosmetic defect, if it's progressive, or it bleeds profusely. Those are the 4 reasons I might go in and do surgery. Usually they don't have any of those 4. So I'll do this. I'll treat this around gum recession. Mostly it's around healthy teeth. If it's diseased teeth, I'll still offer them to do surgery, but 9 out of 10 do not want to do surgery. They want to try this. And 80% of them are very happy with it.
And first of all, I mean, I'm just going to get to some of their questions, and we've got a few more come out. What's the risk of vascular occlusion for gum builder?
0.
Yeah, there's no risk. There's no arteries there.
Yeah, there's no blood vessels there. You don't have to worry about vascular conclusion, no vascular compression. 0. Right. Just get it out of your mind. It doesn't exist.
Yeah, there's no VOs when you're talking about capillaries because there's so much redundancy of the vasculature for that. So there's never I mean, have you ever seen necrosis? I've treated dozens and dozens of teeth. I mean,
I've never seen necrosis.
Right. There's not going to be necrosis. You're not.
You can't.
You would have to block an artery, which there are no arteries that are running through the gingiva for all.
I saw a question which says, does it make recession worse? Never. It only makes it better.
Right.
And it's, remember, you're taking away the fact that these people now know they're not going to lose their teeth because of recession. And I've had people cry in my chair that they've been so afraid that they're going to lose their teeth. When you do this, you're also setting up a barrier which is going to prevent any further recession. And that gives them such peace of mind, you have no idea.
Now you do both. You do both surgery and obviously you do this. Periodontists generally will have a higher acceptance of surgery because you're getting referrals from a general dentist. You know, I mean, the patient still will refuse surgery, even for
Right.
periodontists, but generally you get a higher acceptance that you're getting the acceptance of patients that I send as a general dentist to you that have said, I'll consider surgery. Most of them never get to you because they won't even consider surgery. But what's the acceptance to surgery versus gum builder in your in a periodontal practice?
Gun builder, I'd say I have 90% acceptance. And even though when a general dentist sends me for surgery, 50% at most want to have surgery. And a lot of times the general dentist is sending for surgery, it doesn't need it. So I can treat these cases non-surgically and they are elated. So acceptance rate is incredible. Everybody wants it. I mean, there is nobody that doesn't want it. And, you know, you'll make easy, lucratively, you make, since I started this, I'm making $5,000 to $6,000, $7,000 extra a week. It's really remarkable. And everybody loves it. There's really no downside to this at all.
Right. Now, so let's go. What do you charge for this? Now, remember that he's on Fifth Avenue in New York City, so it might be a little higher, but I don't know. What do you charge for it?
If I'm doing a full mouth, I might charge $2,500. If I do a quadrant, I'll charge $750 for the quadrant. It's rare there's just one tooth in a quadrant that has recession. So if it has 2 or 3 teeth, I'm still charging $750 for the quadrant.
Right. And you have no problem doing full mouth. I mean,
No,
I want dentists to think big because what's really interesting about what you just said is that, obviously we know you and you're one of our AAFE faculty members, but we've got a number, we're doing this big study on Gum Builder. Again, 500 patients, 50, 60 dentists are involved, and we've got a number of periodontists. The dentists are sending in cases everything from, one tooth, 5 teeth, that the periodontists are sending in cases for this study full mouth. Like and I guess we need to learn as general dentists from the periodontists. It's like every single periodontist that's doing Gum Builder as part of the Gum Builder study. I'm amazed when I say like full mouth. They're just doing full mouth. They didn't even think twice about it. So we need to think bigger as general dentists.
it
But
takes about
pretty
5
much did the
minutes,
same thing. What?
5 to 10 minutes tops to do a full mouth. Once you get the technique and the flow goes, your hand just goes by itself. And you go from tooth to tooth to tooth to tooth to tooth. It's really easy. There is a learning curve, and it takes a little while. And if your syringes get blocked, it just means you're injecting too fast or you're pushing too deep. So you got to just remember, you're just barely breaking the surface. And once you get the technique, you can do it in your sleep. It's really, really easy. But remember, you got to do 2 rounds on every tooth. Otherwise, you can't, so I do the whole mouth, and then I'll go around and I'll do it again.
Right. Total treatment time, 2 rounds.
10 minutes.
Right. 10 minutes. I mean, the talking takes longer. I mean,
Yeah.
that little clip that you guys saw was him injecting. You saw how fast he was injecting. You can go a little slower. If they want, they can go slower, right?
Oh, yeah. I mean, you want to, when you first learning, you want to go slow. In order, it's technique sensitive. So you want to come in at a 45-degree angle, bevel up, inject very slow. If you inject too fast, you're going to go too deep. It's going to get clogged. So you got to inject slowly and watch the material extrude from the tissue. You really want to bleed the syringe before you start injection. So before I'm even injecting the tissue, I'm bleeding the syringe, and then I'm doing 5 spots around each tooth, and it just flows. It's just like butter. It just flows so easy. It really, but when you take the classes with me or any of the other instructors, you'll leave very confident that you'll be able to do this in your office. And you do have to bring your own patient, because I did see a question that said, do you have to bring your own? You do want to bring your own model to do this. We can't supply the models for you, but it's better if you bring your own, because then you can follow it in your office afterwards.
Yeah, and I'll say the same thing, I think, and we've had a couple of questions about that. for any of our Botox and filler training, same, ideally bring your own patient because you're going to see what happens to them when you take them back home. If you can't bring a patient, you can find one at the course. I mean, that happens all the time. So that shouldn't stop you. But, whatever you can do to bring your own patient, it's a better learning experience. So we highly, highly recommend that. But we understand there are times you can't, but you can always find a patient at the course for that. So I'm going to keep answering questions. People are still asking, is this permanent? I'll let you handle that, Neil. Is Gum Builder permanent?
To me, from my experience so far, I found Gum Builder to be permanent. Black Triangles, not so much the case. Because when you're doing Gum Builder, you actually build an attached tissue. The attached tissue that you build is not going to go away. When you're doing a Black Triangle, you're filling up the papilla with the filler. Eventually, the filler is going to resorb out. The Black Triangle is going to reoccur, even though you are creating some new tissue. So a Black Triangle will probably have to be retreated 6 months to a year. Depends on the material you use. If you use Kaha, you probably get a year. If you use hyaluronic acid, you probably get 6 months. But when you use Kaha for the attached tissue that's forming, I haven't seen it disappear at all. It's going to stay. There's no filler in that attached tissue that it's going to go away. So that's another big advantage of this.
Right. I mean, this turns to collagen. It turns
exactly. It turns to collagen.
Yeah. So that's the difference. In the Black Triangle, the volume is provided by the Kaha material, or if you're using a hyaluronic acid, if you guys know what that is, then that's going to go away. Then it'll deflate a little bit. Here, the Kaha is going to be gone. I mean, what you're going to have is real attached tissue. It's real regeneration. I think that's really important. Now, and permanent is, a relative term.
Well, the study just started. It's a year to a year and a half. Right. So,
No, I know, but permanent, like we can't control. If they start doing something crazy, like using a hard toothbrush and start rubbing the heck out of it.
Which I tell the patients, don't use nails in their mouth or hard toothbrushes. Then it's going to come back on their own accord. But it shouldn't come back by itself.
Right. It's as permanent as their gum tissue is, right?
Correct. Correct.
I mean, that's the way we would put it. Dental hygienists do this?
No, dental hygienists are not licensed to do that. In New York State, they can't do it.
New York State, they can't. Now, there are about 7 states where dental hygienists can give fillers. There, they can do it for sure. There are other states where dental hygienists can do lasers. Dental hygienists can give local anesthetics. So we're working with a lot of those states who are looking at this, at least just for Gum Builder for this. But the states where they can do filler, dental hygienists can do this. It's about 7 states right now.
Now, remember, this is in our wheelhouse. You don't have to worry about dental boards or anything. We're the only profession that can do this. Plastic surgeons don't do it. Dermatologists don't do it.
Yeah, they hate the mouth.
This is our baby. And
they don't want to touch the mouth.
Yeah, they're not allowed. And it's within our scope. A lot of states don't want you to do Botox and fillers. This they want you to do. There's no contraindication by the state board that you can't do this right away.
Okay, let's go on to any risk of the fillers migrating.
If you don't inject correctly, it could migrate into the mucogingival area. You might get a bulge of Kaha there. All you got to do is press the area, dissipate it, and it'll go away. But the migration is not a problem. It doesn't cause any pain. It doesn't cause any vascular occlusion. But remember, you have to inject an attached tissue. You can't inject in mucosa because when you inject in mucosa, the material can migrate down. So you have to inject. And you also want to inject in teeth that are pretty much inflammation-free. So when a patient comes in, you want to clean them up, get rid of all the tartar, the calculus, the inflammation, and then you do the Gum Builder. I found if I do Gum Builder in inflamed tissue, I don't get a good result.
Right. Gingivitis, everything should be resolved.
Exactly. You want to treat that first.
You should be injecting this in the good, healthy. Regeneration works in good, healthy tissue. And
correct.
So, periodontitis, gingivitis, all that should be resolved and work with a really good clean area there. Talk a little bit about, I forgot already how long it's been. Talk a little bit about the injectable part of your practice and that, because he's wildly successful. And don't tell me about competition. He's in a building with 8 plastic surgeons and a bunch of dermatologists. So talk about that, because you've been doing it for a long time.
Yeah, I've been doing this for about 15 years, and I get a high flow of traffic. My fees are relatively competitive. I'm always a little lower than the next guy to get more people in. I'd have to say 60% of my practice now is cosmetics and 40% is perio. But after 40 years of doing perio, I have no problem with that. So I'd rather do more cosmetics. It's easier, it's more lucrative, and it's fun. So that's it. And the gum builder now, I do it every single day. There's not a day that goes by where I don't do gum builder.
Right, but I just want to make the point. He does a ton of neurotoxin filler. I mean, he does a ton of that in a in probably the most competitive market that is out there. How do you get along with the do you get along with the plastic surgeons in the building?
Yeah, I get along with but initially, no, they didn't want me to do it. But now, being that I refer to them for blepharoplasty, for nose jobs, for elderly people that want facelifts, now I'm their best friend. So remember, you're doing procedures that the plastic surgeons don't want to do, or the dermatologists don't want to do because they want to do the 50, 60, $70,000 facelift. If you can do a case for $1,500, $2,000 with threads, patients are related. So we get a lot of that traffic, that the ones that do not want to spend $50,000, $60,000 for facelifts. So I don't have any real competitions with the plastic surgeons because they don't really want to bother with this stuff. So it's pretty easy to sell.
Right. Here's a question. Can we change the phenotype of the gingival tissue with gum builder?
Not you really can't change the phenotype. It's pretty much you're going to get the layer of tissue you form is very thin. You're not going to get a thicker band of tissue, but the tissue you form is relevant. It prevents further recession. You're not really going to change the phenotype.
Right. Why did you take your first the Botox course? Do you remember?
Yeah, because I just anticipated that dentistry wasn't going to be enough for me 15 years ago. And I was excited about to do something else, and I hedged my bet. And I'm glad I did because I wouldn't survive if I was just doing perio now. So, doing all these extra procedures has made my life a lot easier and a lot better, so that's why I started it. And I'm glad I did.
Yeah, it's a lot of fun, right?
It's fun. It's great. And like I've been doing it for 15 years now, and I don't look back at all. And I'm always looking forward to new courses that the AAFE gives and teaches. The AAFE is far away. I've taken courses by Empire Medical Training and Delgado, all those courses. Far and away, the AAFE gives you individual treatment, and it's a family. I mean, they never leave you alone. And that's great.
He's one of our, I'll call you one of our senior faculty members because
Right.
he's been there. He's been there for a long time for this. Wait, here's one more. I'll take one more question and then we'll let you go and then we're going to wrap up and I'll take training questions and finish up. I really appreciate you being on.
My pleasure.
What about gum builder around implant sites?
It's great. You can do gum builder around when I uncover an implant, I do gum builder immediately. So it's great because remember, you're always going to get a little bit of recession when you uncover an implant, when you put a new crown in, when you have an existing crown, when you Invisalign. These are all areas that you can do gum builder. We're expanding gum builder now to areas that we anticipate recession that not necessarily have to have recession. So what areas are going to recede. And especially Invisalign cases, lower anterior cases, before we start an Invisalign case, I'll do gum builder on all those teeth, where then we used to have recession, now we can prevent recession from developing. So it's not only recessed areas, you can now do it in areas where you anticipate recession, which just adds a tremendous amount to your practice.
And that was one of the questions, before was, do you do it before, during, after?
No, you want to do it if you can do it before and the patient's willing because they're paying a fair amount for the Invisalign, but I'll lower the fee to do this before. If they wait till after, Invisalign case can take a couple of years the time they get to you. So I try to do this prior to any Invisalign case or any orthodontic case. And I'm getting referrals from orthodontists now that want to have the gum builder before they even start the case. So it's really good.
No, that's really great. I'll show you courses in January. All right, Neil, I appreciate that. I'm going to wrap up with all these folks.
Okay. My pleasure. And have a good night, guys.
All right. Thanks so much, Neil.
You're welcome.
See you. Appreciate it. All right, let's go ahead. All right, let me wrap it up with you guys. I'll answer any training questions. I'll show you when his course is in January. So again, thank you, Dr. Neil Valens, for this. Okay, here is, I've showed you this already. So Here are the different courses. You can choose from these courses. We have more courses. These are the live patient courses. Again, afedentist.com. So you can use any of these. Most of you, if you're just getting started with injectables, if you're going with that all-in clinical package, you're going to do level 1 Botox, level 1 fillers, level 1 TMJ, and then, or again, you can choose the live patient gum builder course there as well. Best faculty in the world, and Dr. Valens is in this picture somewhere. I'm just not going to take the time to go ahead and see it. But he's in there somewhere. But you just saw him. afedentist.com. These are the locations. We're all over the United States, and we have training centers. And Dr. Valens is in New York City, and we have a training center there as well. This is what you saw. I just want to get to. Let's go through these bonuses. A few of you have been asking about these bonuses on the various platforms that we've been on. For this, you're getting over $13,000 worth of value and bonuses for this $39.97 package. And I tell you, this is 5 to 6 patients, and this pays you back. This is not your dental school tuition that you're going to have to pay off for the next, 20 years or 10 years or 5 years. In the first month, we want you to be able to pay off your tuition, and then that is the best investment you're ever going to make. But bonus number 1 is you're going to get the Gum Builder Black Triangles online certification course. For that, if you want to use one of these for the live patient, you can use that and swap out bonus number 1 for something else. Bonus number 2, up to $1,100 of injectables to be used as the course. Bonus number 3, the AAFE Med Spa Aesthetic Practice Business On-Demand Training. You need on-demand training for business, business part 2. So we cover all of that in that course that's added on for this. You will not find these bonuses on the AAFE website. This is only for this webinar. It's only till midnight tonight. And I think about, maybe 14, 15 of these packages have been taken. So if you want it, you better get it now. And again, lock it in. You take these courses next year or really whenever you want for that. Team members you can bring per course, exclusive member forums and post-course support. They're going to push you to get started. No one else does this. They're going to push you to get started so you can recoup your investment. But more than that, you can be successful. We know one thing in the AAFE. You take a course, and I've been teaching dentists for 45 years, all kinds of different things, from veneers to implants to certainly injectables. I know one thing. The sooner you leave a course and get started, the more successful you are going to be. We've got thousands of AAFE members, and that's how it always is for that. So 12 months of AAFE membership, AAFE member office locator. We get thousands of patients that come to the AAFE website every single week looking for AAFE providers. Use of the AAFE logo, all the office forms needed for injectable treatment, all included, discounts and additional courses and marketing materials, all for $39.97, all right here only for that. So that's all you're going to get, and you're only going to get it right here. And again, course suggestions are going to be, again, if you're just getting started, you start with our foundational courses, level 1 Botox, level 1 fillers, level 1 TMJ or all facial pain. You can take the advanced courses. You can take the master courses, level 2 or level 3, really whatever works for you here. The next time is December 12th. So that's in New York City with Dr. Valens, or in January, that'll be with Dr. Valens as well for that. So he's got 2, and then he's come. I guess it comes up every month: December, January, February, or March. Or you can go to Waxhaw, North Carolina, Charlotte, North Carolina. You can go to Scottsdale. You can go to Chicago. You can go to Los Angeles. You can go to Las Vegas coming up in February. But lock this in now. These are with the stars. We have something that we call our Core 4, and that is going to be 2 days of AAFE training, level 1 Botox, level 1 fillers, level 1 TMJ, and Gum Builder, all in those 2 days for that. So that is really amazing. Can you start? That's a great question, Hiru. Can you start Gum Builder treatment after the online course? So some of you will be very comfortable. If you're already comfortable working on gingiva a little bit, many of you can start right after the online course. if you just sign up for the online course, you can always apply that tuition to a live patient gum builder if you want to come for the live patient experience, if you want more than that. But yeah, many dentists will start doing gum builder after that online course. But again, if you take that online course and you decide you want to do the live patient course, you can apply that tuition. You won't lose that tuition and that investment for that. But if you want to take 4 courses all at the same time over a 2-day period, then one of the core 4 dates, which are with the stars, New York City in January, Las Vegas in February, you've got 4 different core 4 where you'll take, and that is an action-packed thing, and you will be ready to go. Again, we want to get you started within 14 days of Botox, fillers, TMJ. You're going to have to do the work, but we're going to go ahead and push you to get started. We want you to get back your investment as quickly as possible for that. So that is really what we're looking for. So last call for this before they're gone. Either 20 packages are gone or midnight is gone, and whatever comes first for that. Oh, I forgot, I mentioned before, who wants to see a Botox case? If you want to see a Botox case, we're going to show you that to you right now. Those of you who've never seen Botox, let me show you a quick Botox case. You can see it. It looks really easy, but that's because they've been very well trained by the AAFE. But here we go. Let me just turn off my video, and we'll show you a quick case, and then we'll take any final questions. Here we go.
Okay, Denise is here, and she is ready for toxin here. So what Jill is doing is she is going to go ahead and mark her up. She'll get a good sense of her. She's looking at the temporal fusion lines, and I'm just going along with what she's doing here. So she's looking at temporal fusion lines, which is going to be where your ends of the frontalis are going to be. Oh my God, Denise, look how active your frontalis is. Denise does she usually get this bad here after she's been coming in every 3 months for a while, right, Denise?
Mm-hmm. She's usually like this.
Yeah.
She just has like pretty strong.
Yeah, she's got very strong muscles. She's very impressive. And so now we're going to do crow's feet. And Jill, you like to mark up, right?
I do.
You like to mark up every single patient. That is provide your preference on that. And it really helps you. It really does help you. So you can really get a good idea here. So she's counting up. How many units are we doing in her frontalis, Jill?
16 units.
16 units. And so now I just want to go with that. How many dots did you count up?
She has 11 dots, and I use tight dilution. So you can see I have 16 hash marks, and I'm going to pull this back to 22 total hash marks. And then I'm going to push 2 hash marks per injection site.
Right. So if you don't know how to go ahead and dilute your toxin, then you gotta learn it, because Jill loves to use 1-to-1 dilution, right? Is that what you pulled out?
Yeah.
1-to-1 dilution. If you don't know what 1-to-1 dilution is, then it's time for a level 2 course in the AAFE where we teach tight dilution and then different dilutions as you go up. All right, let's talk about the procedure. So she has determined exactly where to get the best spread of the botulinum toxin that she is using. And in this case, you are using Xeomin here. And this is we bumped her up a little bit over last time, or this is the same as last time?
This is the same as last time.
Okay, this is the same as last time, and using ComfortDoc syringes, and those are the most comfortable by far. That's why they're going in so easily into the forehead. How was that, Denise?
Easy.
Yeah, she's easy peasy. She's done this before. Wiping up and away from the eyes always is the way you're going to get the best results. And now glabellar area, and we are going to go ahead and she's going to grab it, isolate it, go in and give it how many units, Jill?
We're giving her 20 across the
20 across the glabellar area here. Alexa, stop. I don't know why Alexa keeps coming on here. Look how she is holding this tissue here. She is really going to make sure it stays in the corrugator muscle here. And here you can see the other side there going as well. And Denise knows not to go ahead and touch her face here. By the way, take a look. Denise has got very deep set eyes, and that's a really good thing, certainly a good thing. And that's why she can get 16 units in her frontalis without any worry about an eyebrow drop here as well. So now what are we doing here, Jill?
We are doing 14 units total.
okay, and her crow's feet.
Mhm.
And that is going to be always away from the eye is the way we like to go ahead and do it here. And we're just going to go all the way around to make sure you get that lateral orbicularis oculi here. And she is doing great. And where are we going next?
Just the other side. and then
Other
we're done.
side. Okay, other side, and then we're done. There you can see some of the venous complex there. So we're just going to try to stay away from some of it. Patients can bruise. That's normal and acceptable for all this. Alexa, stop. We're talking here, Alexa. Okay, but we're almost done here anyway. And you can go ahead and see that. So this is a very quick, really quick treatment for Denise here. Denise, do you like getting neurotoxin?
Love it.
Yeah, she always loves it, and that's always good. How long? So tell everybody, how long does it take to kick in on you, Denise?
Probably about 2 weeks, 4 weeks is like the
Yeah.
spot.
Is the spot when it really is really? But you start noticing a difference, like
Almost right. I'd say within the first week, I notice a difference.
Okay, and then she will be back for more. And you coming? Are you coming to get some work next week?
I am.
And then we have a faculty summit next week where we train the faculty on all kinds of things. And what's she going to get? She's going to get
Temple filler.
temple filler. So we are going to bring you the latest techniques, so you will see Denise's face there again. All right, thank you very much. That didn't take long. This is not even a 5-minute video. Look how much you can accomplish in 5 minutes. All right, Denise, say goodbye to everybody.
Bye,
All
everybody.
right,
Thank
see her
you.
again. Jill, say goodbye to everybody.
Bye, everybody.
Okay, they love when we do these videos. All right, thank you both. We had to share Denise's before and after. She's a repeat neurotoxin patient, has been getting it for a while, and her face just looks different. It's relaxed, it's smooth, and she absolutely loves what it does to her face. Also, a little bit of oral facial pain. She goes through her neurotoxin and her fillers pretty quickly because she is an athlete, and athletes have higher metabolism. Even at 3 months, you can see that it pretty much disappears completely. So recognize that on your patients there as well. She'll be coming every 3 months, sometimes get a little longer effect, but she's a great patient, gets a great result, and it's time for you to really up your game with the foundational and advanced procedures of neurotoxin for your patients so you can get the best AAFE results possible.
All right, so that's just to give you an idea. But those of you who signed up for courses, I am really proud of you because you have made a great investment in yourself. So congratulations to Pete, to Hero, to Jonathan, to Enrique, to Holly, to Constantine, to Kathleen, to Bill, to Morgan, to Brandon, to Farah, Aviri, to Clifford, to Hina, and to Jennifer. I don't know if I missed anybody. I'm sorry if I did. But you can get a sense that a lot of these packages are gone. I don't know what you're waiting for, to be honest with you. I really don't know what you're waiting for this. This is probably the only investment that can pay you back within literally 14 days, a month. Let's say it even takes 2 months. Any implant course cannot do that. Again, that's not one or the other. You should train on implants. You should train on Invisalign. You should train on all those things, but that's not going to pay you back as quickly. By the way, implant training, just aesthetic restorative training. I mean, I saw an advertisement for, a veneer course and that kind of stuff. I mean, it was $10,000. This is so much less, and this goes so much further. So, if you want the Core 4, this package is a 3-course package. They will add on a 4th when the AAFE gets hold of you tomorrow. They'll add on a 4th course at a pretty big discount. I think only for like $1,000 more, which is another $700 savings for that. So Hero, you're asking that question. So you had one of these packages for that. Yeah, the AAFE they'll give you the option to add on one more course, so you can take. At that Core 4, you can take, all 4 courses at one time if you want it for that. But honestly, this happens all the time. I get, people will finally, they'll come onto a webinar, another webinar. They'll finally do this. And then 6 months later, they're killing it like Dr. Valens was killing it with injectables. They can't believe the growth of their practice. And their biggest regret, they tell me this all the time. Their biggest regret, I don't know why I didn't do this like 2 years before that when I took your first webinar on Botox or on gum builder, that kind of stuff. I could kick myself for waiting so long to do this. And that's exactly right. I mean, you're talking about a $39.97 investment, or again, a $15.97 investment if you just want the live patient gum builder for that. But $39.97 is one of the least expensive courses in dentistry. For the return literally is the first month. There is nothing. There's no restorative course that you're taking. There's no crown and bridge course. There's no implant course. There's certainly no ortho course that you're taking where you're going to get that investment back within the first few weeks, within the first 5 to 6 patients. And again, and maybe I get it if you don't want to be pushed, but if you come to AV training, we are going to push you to get started because we want you to be successful. If you want to take a course and sit on it for 6 months, I will tell you the AAFE is not the right place for you because it's silly. I mean, early on in AV training, people would tell me, yeah, I took the AV course and then I didn't do anything for like a year. Why? These are all your patients are getting these services somewhere else right now. They're paying somewhere else. Why shouldn't they be paying you? And they'll start paying you tomorrow. And again, the Botox and the fillers, none of that's covered by insurance. It's none of that nonsense. This is really incredible. And I will tell you that dentists are by far the best injectors of any other healthcare professional out there, by far, because you give the most injections of any healthcare professional and you give them in the face. Now, that happens to be in the mouth, but that's in the face. You're comfortable with injections. You start giving Botox and filler injections, and I will tell you this, it's incredible. It's a lot easier than local anesthetic injections in the mouth because you can see what you are doing. And this is the only place where you're going to get all these bonuses. So those of you thinking about it, stop thinking about it and go ahead and pull the trigger so you can get started literally right away. So congratulations to all of you that grabbed these packages. Again, there are probably 5 left or 5 or 6 left before midnight tonight. Once midnight goes, all these bonuses go away. Then whatever is on the AAFE website, you can certainly pay more. I'm sure the AAFE doesn't mind if you go ahead and pay more for that. I mean, why would they mind? But this is a fantastic, fantastic deal that I've never seen before with all of these bonuses for that. So really, it's great. I mean, you can take advanced courses and do all those things for that. We have all those advanced courses, Shelley. We take, again, Canadian dentists come all the time. You can do all of this. And again, you can apply this package to level 2, to level 3, whatever level courses you would like to go ahead and do for that. So let me take some final questions. Again, here are your 3 options. If you just want live gum builder training, you can sign up for that $15.97 package. Or if you just want the online at $9.97 for this. Yeah, I mean, some of those can be done together. You'll have to contact the AAFE and find out exactly what courses are given together on what different weekends that they have for all of that. And with that, I want to thank you so much. We have had hundreds of you hanging on and sticking around with us. Wow, I cannot believe how late it is. Wow, thank you so much for sticking on. I didn't even realize what time it is. My clock is blocked by my microphone here. I just saw it. Thank you for sticking around with us. I hope this was helpful to all of you. There's my contact information. There's the AAFE's information as well. avdentist.com. This is the only place and the last place that you're going to get these offers till midnight tonight. The Gum Builder and the Ultimate Gum course, if you want those individual courses. StatDDS, that's where you'll get all the syringes or the radius, everything else. And always keep an eye out for afewebinars.com we always got webinars coming up, and we appreciate being. Thank you, Shelley. Thank you to all of you for being on. Congratulations to all of you who already got packages. We cannot wait to work with you and make you successful and work together with all of you. So until next time, everybody, continued success.